Good evening. I'm Susan Kennedy, and welcome to our virtual town hall meeting where we will provide the latest information on the COVID-19 vaccine rollout plan here in Montgomery County and give our residents the opportunity to get their question answered directly by health and elected officials. We're so pleased you've joined us this evening, and we've assembled quite an expert team to answer these questions. But first, I'm going to turn it over to Council President Tom Hucker for some opening remarks. President Hucker.
Thank you so much, Susan. Good evening, everyone. Thank you all for joining us tonight for a very important COVID vaccine update. Since the beginning of this pandemic, the County Council has been very responsive to our residents. We called this emergency town hall in response to the overwhelming number of questions and concerns that we've received about our vaccination plans. In less than 10 days, we received over 2,300 registrations from county residents to participate in this event tonight. Across the nation, local governments like ours are responsible for deploying COVID vaccinations on our own because there's been no clear implementation plan from the federal government and because vaccine distribution is occurring on a rolling basis in every state. The widespread distribution of the COVID vaccine is the greatest logistical task our county, state, and country have taken on in decades. And our highest priority for 2021 is to execute a comprehensive, coordinated vaccine distribution to combat the virus. This is essential to protecting the health and welfare of all of our residents. Montgomery County has a distribution plan in place, and we are executing it, but we rely on weekly vaccine allocations from the state of Maryland, and those allocations have been insufficient and unpredictable to date. Still, Montgomery County remains #1 in vaccines administered in the state, and we are so grateful for the performance and the hard work by our health officials, including so many you're going to hear from tonight. As of last Friday, January 15th, all 19,800 doses that had been allocated to our county by the state were successfully administered. This week, we've received an allotment of 7,300 first doses and 4,300 second doses, which we've already begun distributing. We're all eager to get our community, especially our immunocompromised and elderly loved ones, vaccinated quickly and to get our children back in school safely. With the dawn of a new administration in the White House, I'm hopeful that there will be a new opportunity to ramp up vaccine distribution and that the health experts appointed at the federal level will successfully lead a national rollout plan. However, we also need state leaders to work with us to implement a successful rollout plan as well. The state government, not individual counties, has primary responsibility to protect public health and the authority to regulate healthcare under the Maryland Constitution. And former Health Secretary Bobby Neal testified to the State Assembly that the Maryland Department of Health would be accountable for the vaccination plan. But unfortunately, you'll hear tonight a familiar refrain that our county's top leadership and our health leaders in particular are not receiving the communication and collaboration that they need in order to properly plan and prepare for the gargantuan task ahead of us. This is really unacceptable because lives are on the line. We need the administration's health leaders to communicate clearly and work with us collaboratively. Unfortunately, after repeated discussions I've had with the top staff in the governor's office and the top government relations staff at the Maryland Department of Health, not only did Acting Secretary Schrader not make the time to attend our event tonight, but MDH was unable to send a single staff person to answer your questions tonight. The department has over 3,000 workers, but they've refused to send a single staff person to join the town hall to inform and address the concerns of residents from the most populous county in Maryland. I was told that if Secretary Schrader accepted an invite to speak in Montgomery County, he would have to accept an invite to speak in every local government. And let me be clear, that's exactly what the acting secretary should be doing, speaking to all 24 of the governing bodies of Maryland's 24 jurisdictions, starting with Montgomery County, the largest one. This is the most important work they could be doing right now. I say that to stand up, not just for Montgomery County, but all of our local jurisdictions across the state. We're all in the same fight together to defeat this virus. If the acting secretary or his staff change their mind and join us tonight, we're holding a Zoom panelist invitation open for you. Our entire county government and the thousands of constituents watching tonight would welcome you to participate in the listening session this evening and to answer questions. Unfortunately, without the state's participation tonight, there will also be many questions we're just unable to answer. Our staff will be keeping a parking lot tonight to log any questions, and we will follow up with the state to receive answers. There will also be many more questions received tonight than we can answer. The County Council is committed to responding to every question that we receive tonight. I'm eager to hear from all of you and get to your questions. So with that, I'll turn it over to County Executive Mark Elrich. Mark, thanks so much for joining us tonight.
Sorry. So thank you. And I want to thank everybody for being here, the county staff and the county council, and having this town hall. I think, many of us are as frustrated as many of the citizens out there in terms of the information we have and the way the vaccine has been rolled out. This has been really difficult. The governor added last week all people over the age of 75 starting this week. That's a bit of a problem. We still had 14,000 people in Group A who hadn't gotten vaccinated, not because we couldn't vaccinate them, but because we couldn't get vaccines. And these are frontline health workers, and absolutely critical to make sure anybody who's in the health field and dealing with people who could be infected is getting vaccinated. So we don't have the doses we need. We were told today that the state is getting an allocation of 72,000 doses a week for the state. We are getting, or I should say the public health clinics are getting about half of that, and the county's getting about 21% of that, which means we will be getting a little over 7,000 doses a week. And this week we got 7,000 doses plus 4,300 doses for the people we had vaccinated, 4 weeks ago. Next week, the number of previously vaccinated people will be 8,000. And so if we're limited to basically 12 or 13,000 doses, it is going to be a long time getting through this list. To put it in perspective, the senior population 75 and older is over 70,000 people. At 7,000 doses a week, that's 10 weeks. The group of adults between 65 and 74 is probably close to 91,000 people. That's another 13 weeks. And the teachers who we desperately need to get vaccinated to get the schools reopened again, that staff equals almost 30,000 people. That's another 4 weeks. Unless we get more vaccine, unless the state gets more vaccine, it is going to be impossible to accelerate their timelines. And so I appreciate everybody's frustration. Trust me, I get a lot of email asking why they can't get vaccinated, telling me about important people in their lives who need to get vaccinated. And all I can say is I've got 7,200 doses for new people, and I've got a waiting list that's far longer than that. We have tried to work with the governor. The governor's lack of communication isn't just with Montgomery County, it's been with all of the counties. We have not been able to work with them since early during the period when we were doing testing. And the governor used to meet with us, and then he stopped meeting with us. We do get to talk to his aides, but we are not part of any planning. We didn't know how many doses they've had to be working with. That's information we didn't have. We didn't understand the rationale for why people got the amount of doses they were being given. We've got no coordinated plan for who is going to serve which portion of the population. How much of the population is supposed to be served by our doses? How much of the population is going to be served by the pharmacies? How much of the population is going to get served by the giant food stores, which the governor announced we're going to distribute vaccines? They are getting 50 doses a week for the giant food stores, each one, 50 doses. 4 stores, 200 doses a week. So this is not a good enough plan to get us where we need to go. We need more vaccines. Many of us are counting on a new president figuring out a way to get those vaccines out into the public so we can plan. But at the end of the day, we're going to need the governor to work with all of the counties to come up with plans over whose job it is to vaccinate which portion of the population. And so we can seamlessly register people and move it forward. Right now, you can you can actually call in and register, and we will be able to make appointments. And next week, when the 65 to 74 group is eligible, then we will also be adding a registration for them. So we are prepared to register you. We are prepared to vaccinate you. We just need the vaccines to do the vaccinations. I'll stop there, but I just hope everybody realizes how incredibly frustrating it is not to have the doses we need after all the time that we've been talking about this. It is just a real, I guess, a monument to failure on the part of the federal government.
Thank you, Mark. Let me throw it back to Susan Kennedy for a quick announcement about translation.
Yes, thank you very much. We want everyone to know that we are simulcasting this broadcast this evening in Spanish. We have Lillian Moss with us, who is going to give instructions to those folks who may want to transfer over to the Spanish channel who have just joined us. So Lillian, could you provide that translation for us, please?
Buenas noches, yo soy Lilian Masi. Para las personas que quieren escuchar todo lo que será esta junta comunitaria en español, pues déjenme decirle que tenemos la opción. Si usted quiere escucharlo y se está conectando en su computadora, lo único que tiene que hacer es ir a la parte de abajo, en donde encontrarán una opción en la parte inferior derecha de su pantalla. Ahí verá un mundo. Al hacer clic en ese icono, podrá elegir la opción del idioma el español. Si está conectándose desde su teléfono celular, puede hacerlo de la misma manera. En la parte de abajo va a encontrar 3 puntitos continuos. Al tocarlo, le darán varias opciones. Usted debe de escoger la opción que dice Language Interpretation o interpretación del lenguaje. Una vez allí, elija el idioma español. Bueno, con eso damos inicio a lo que será esta junta comunitaria. Espero que sea de su agrado. Susan.
Okay, thank you, Lillian. Mr. Hucker.
Thank you so much, Lillian. Let me turn it over for a brief couple remarks from Council Vice President Albornoz, and then I'll have my colleagues introduce themselves in alphabetical order. Council Vice President Albornoz.
Well, thank you, Mr. Council President. And just a few words, because we want to get to the Q&A. But as you heard from the County Executive and our Council President, there are numerous challenges before us that can some days feel overwhelming and can some days feel disorienting. And we know everyone is exhausted, anxious, and tired of this pandemic. And we know that too many of our residents in Montgomery County have lost their lives or have family members who have been deeply impacted also because of the economic challenges related to the pandemic. So while the challenges are numerous, I do want to highlight the good news. The good news is we have an extraordinary Department of Health and Human Services and an incredible public health team here in Montgomery County. For the last 2 years as the chair of the HHS committee, I have been able to see their work, and 12 years before that served as the director of the recreation department in the county and worked side by side with many of the people in the current administration. And they have been working day and night since the beginning of the pandemic. And it's not a coincidence that Montgomery County is doing much better than any other county in the state in disseminating the vaccines. We have the capacity today, right now, to administer between 2,500 and 3,500 vaccines per day. We just need access to more vaccines. And so moving forward, I'm confident that the challenges with the federal government and our state government will improve, and that coordination will improve, giving us a much better ability to be able to provide more vaccines to the people that need them most. We thank all of you for your patience. We understand your challenges and struggles. We are here to serve, and we thank you, all of you, and our partners in the community, including our minority health initiatives and program, as well as our hospitals and frontline medical personnel, primary care clinics, and so many more, including our disability community, who are working tirelessly on behalf of our most vulnerable populations. Together, I am supremely confident that we are going to get through this dark time. Thanks so much.
Thanks so much, Gabe. Let's let our colleagues introduce themselves. Councilmember Friedson, I believe you're first in the alphabet.
Thank you, Council President. I'm Andrew Friedson. I represent District 1, which is Western Montgomery County. I serve on the Government Operations and Fiscal Policy Committee and the Planning, Housing, and Economic Development Committee. And appreciate the opportunity to join. Looks like we have a great crowd this evening and look forward to hearing your questions.
Councilmember Glass.
Thank you. I'm Councilmember Evan Glass. I'm an at-large member of the council, and I serve on the Health and Human Services Committee. And I know that you're all joining us because you're concerned about your health and the health of your friends and family. And we're doing everything that we can here in Montgomery County to protect you. And as has been said, we need the governor to step up and help us with our vaccine distribution.
Thank you. Councilmember Jawando.
Thank you. Yes, Councilmember Will Jawando. I'm also an at-large member of the council. I serve on the Education and Culture Committee and the Planning, Housing, and Economic Development Committee. We know it's a tough time. Hang in there. We're working hard for you, and thank you all for joining tonight.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. I'm Sidney Katz. I'm the council member for the 3rd District. I'm the chair of the Public Safety Committee, and I serve on the Government Operations Committee. I'd like to thank everyone for joining us this evening. And for those of you wondering, the 3rd District includes all of the cities of Rockville and city of Gaithersburg, town of Washington Grove, Leisure World, and parts of Aspen Hill, Durwood, Redland, North Potomac, and Potomac. Thank you all for being with us.
Councilmember Navarro.
Good evening, everybody. My name is Nancy Navarro. I represent District 4. I am the chair of the Government Operations and Fiscal Policy Committee, and I serve on the Education and Culture Committee. It's a privilege to serve you, and I want to thank all of you for your cooperation during this very difficult time. Muy buenas noches, soy Nancy Navarro, represento el Distrito 4 y estoy aquí para servirles a todos ustedes esta noche. Sé que han sido momentos muy difíciles, pero quiero agradecer toda su cooperación y espero poder responder sus preguntas. Muchas gracias.
Councilmember Rice.
Good evening, everyone. My name is Craig Rice, council member representing District 2, which is the northern part of Montgomery County. I chair our Education and Culture Committee and serve on our Health and Human Services Committee. I'm very interested in hearing about your thoughts and concerns this evening, and just want to say, as one of the people of color on the council, I'm very concerned about the disparities that we continue to see, and promise you that we're working towards ensuring that when it comes to vaccine rollouts, as well as access to information, that will be afforded to everyone, regardless of the color of their skin or their socioeconomic status. Thank you.
Councilmember Reamer.
Good evening, everyone. I'm Hans Reamer, and I'm in my 3rd term at the County Council, chair of the Planning, Housing, and Economic Development Committee. And like you, it's been a very stressful year for me and for everyone else. And we're getting closer to the vaccinations reaching a wide share of the population, but we're not there yet. I am pleased that the governor has opened up eligibility based on age, but I acknowledge that we don't have the doses yet. But I think that the shakeup has produced some positive results so far, and I look forward to more of that going forward. Thank you.
Terrific, thank you. I also want to recognize Kathleen Connor, District Director for Congressman Jamie Raskin, has joined us tonight. Kathleen, thank you for being here. And Senator Craig Zucker, the chair of the Montgomery County Senate delegation, is here as well. With that, Susan, I think I give it back to you to introduce our panel.
You do. I will get that for you right this moment. First, we have Dr. Travis Gales. Dr. Gales, would you like to introduce yourself for us, please?
Call me right as I was having a drink of water. Good afternoon or good evening. I'm Travis Gales. I'm your county health officer. Pleasure to be with you this evening to talk about vaccines.
Dr. Raymond Crowell.
Good evening, everyone. I'm Dr. Raymond Crowell. I'm the Director of the Department of Health and Human Services. I'm happy to be with you all this evening to answer your questions.
Thank you, Dr. Crowell. Monica Escalante. Is Monica with us this evening? I don't see her. Okay, Sonia Mora.
Good evening, everyone. Buenas noches. My name is Sonia Mora. I am Senior Manager for the Latino Health Initiative at the Department of Health and Human Services. And I have the pleasure of leading a Latino COVID program for the county.
Thank you very much. Do we have Dr. Michelle LaRue?
Yes, good evening. Hello, everyone. My name is Michelle LaRue. I oversee the Health and Human Services Department at CASA. Buenas noches a todos.
Thank you. Beatrice Miller.
Good evening. I'm Beatrice Miller. I'm the co-chair of the African American Health Program, and thank you for having us.
Thank you. Mr. Mehta.
Hello, everyone. I'm Hina Mehta. I'm the vice chair for the Asian American Health Initiative, and we work with the Asian community with the health outreach and education, and glad to be part of this discussion. Thank you for the invite.
And Michael Lynn. I see you're there, Mr. Lynn. Could you unmute yourself?
This is Michael Lin. I also represent Asian American Health Initiative. And I have a couple of questions I'm going to say before the Q&A. It's about the confusion of the vaccine supply. And but quickly, we basically work with our community organization and try to meet their need. And very often they have a unique need that is not necessarily addressed easily.
Thank you very much, Mr. Lin. Now I'll be turning it back to Dr. Travis Gales for a PowerPoint presentation on the vaccine rollout. Dr. Gales?
Doctor, before you start, I just want to also recognize Joan Kleinman has joined us from Senator Chris Van Hollen's office. We're glad you're here as well. Thank you.
All right, good evening, everyone. Is the PowerPoint queued up and ready to go? Or am I queuing it up?
Screen sharing is enabled.
Give me a second. Okay.
Also, Delegate Ariana Kelly has joined us. Thank you.
All right, is everyone able to see the screen?
Yes, we are.
All right, we will go through these really quickly to leave time for questions. So this is the 30,000-foot level setting set of slides. I would like to say before we delve into vaccines, I know that's the topic for tonight, but I would like to remind folks that we are still in an ongoing pandemic where we are seeing record-breaking numbers across the country. The numbers have plateaued a little bit and are starting to trend back downwards in Montgomery County and across the state. However, we obviously are continuing to monitor trends with our hospitals, particularly related to hospital utilization. As of this morning, 3 of our 6 hospitals were in the alert red status, and indicating that they were bumping up near capacity for their ICU staff beds as well as their acute bed coverage. In addition, we're continuing to look at the impact of new variant strains of COVID. To date, we have had 3 cases of COVID-19 variant, UK variant cases in the state, and the state is beefing up their surveillance capacities to be able to test for those different strains. We've not had any of the UK variant strains reported in Montgomery County to date. But we're going to talk about vaccines, and you're going to hear a constant refrain from me tonight. So brace yourselves what I'm about to tell you. A lot of this is based upon the capacity and doses that we have. And so, again, brace yourselves. You'll hear that a lot. And that's not meant to be an excuse or rationale, but it does make it complicated in terms of being able to roll out clinics and set up schedules. Because first of all, we find out our doses, the state finds out their doses midweek, and we are typically notified on a local level of what doses we will receive the following week on the weekend. The past 2 weeks, we received that notification on Saturdays. This week, we actually received how many doses we were going to receive today on yesterday afternoon. So again, want to level set your expectations and clue you into some of the logistical issues that complicate our ability to roll this information out quickly and timely, which leads to your frustration, and I can confirm it leads to our frustration as well. So this is a representation of what our population is and the percentage of folks that remains to be vaccinated. You look, we've got 1.05 million folks within our county, which makes up somewhere approximately 20% of the state of Maryland population. We've had over 31,000 individuals who have received the first shot, and that includes those covered by the local health department, as well as those vaccines that have been provided to hospitals and nursing homes as part of the assisted living facilities and long-term care entities. Now, to explain how that works is, so doses received from the state in the early stages exclusively were sent to hospitals and nursing home facilities. Those doses, the state sends them directly to those places. For nursing homes, they receive their doses through a partnership with pharmacies. So pharmacies are paired with the long-term care facilities, and tier 1 and 1A, they went directly to the nursing homes. And as we move forward into 1B, all of the group homes and other long-term care facilities in the county, we have over 400 of them, are paired with a pharmacy partner who is working to administer the vaccine directly to those residents as well as their staff members. Now, the second pool of vaccines that are being provided to the local level are sent directly to health departments. As county executive mentioned, the state is receiving on average 72,000 doses a week. Now, of those 72,000 doses, they are parsed out in different directions. They go to the hospitals, they go to the long-term care facilities, and a different percentage comes to the local health departments. And as best as they can, the state breaks that down based upon population as well as utilization. And we'll see where we stand in a couple slides. Now, there are two types of vaccines that are currently available. There's a Moderna vaccine and a Pfizer vaccine. There's 2 doses for each of those. I personally received the Moderna vaccine. I will receive a second shot of that one tomorrow. And as a brief update, there are 2 additional candidates that potentially will receive emergency use authorization within the next several weeks. That's exciting because, one, that will hopefully increase the quantity available. And one of those candidates actually produced by Johnson & Johnson is a 1-dose vaccine. We don't have any further information about the clinical efficacy and effectiveness of the vaccine to be able to comment further in terms of its viability as an option. On the right, you see where we stand in terms of our prioritization. The reason why we implemented a prioritization structure is because we recognize we've got thousands of people within these particular groups with a short amount of doses. And so we've tried to create a system based upon CDC and ACIP guidelines, the groups that have put out recommendations in terms of who goes where based upon their potential risk of exposure, in terms of their types of occupation, and their potential risk of having a severe complication. So we currently stand in our 1A group population in those 3 different tiers, trying to move through that so that we can move to 1B. Now, this shows you on the left, it gives us a sense of the total number of vaccines administered. Again, this is inclusive of the doses administered by the health department, as well as the doses administered by our hospitals and health systems and those nursing home facilities as part of that first group. And you can see Montgomery County, in terms of the number of doses we've received, follows the Baltimore County area in terms of the number of vaccines administered. And when you look to the right, you can see the percentage of population vaccinated. And so this is going to be a little bit tricky for us because we have the largest population in the state of Maryland, and yet the number of doses we're receiving doesn't necessarily match up to that. And some say, well, why not request 60,000 doses to get us more through this quickly? Let me remind you, 72,000 is the total number of doses that the entire state is receiving that has to be parsed out to all of these different groups. And hence, the number of doses we're receiving is limited and not as large of a substantial number. Now, I would like to share this. Now, this does need to be updated, based upon the new doses that we received late this afternoon that will be put into circulation on tomorrow. In spite of the number of doses we've received, which pales in comparison to where we need to be, we have, of those doses sent to the local health department, we have administered over 95% of those doses as of this morning. And then after this morning, the remaining 900 we administered 891 of those doses. So that 95% has actually increased. And we have received an additional 7,300 doses for first doses and 4,300 doses for those individuals who went through our program on that first week to get their second dose within the next week or so. Now, here's just the distribution of where those particular sites are that we've utilized throughout the county. In addition to the county community sites that we've stood up, we've also partnered with our fire and rescue partners to administer those vaccines to our public safety colleagues and first responders. And this is a graph that shows where we stand in comparison to other health departments. Again, this is just for the health department sources. And as Council President Hucker mentioned, the health department has been responsible for providing vaccines to everybody in the 1A category who is not affiliated with a hospital or a nursing home or long-term care facility. That's a lot of people. And we estimate just in the 1A category, that's somewhere between 50 to 60,000 folks. Now, here it shows we've administered over 94%. And again, this is actually higher than that when we include today's totals. And you can see where our peer jurisdictions line up in comparison to others across the state. For example, we're over 94%. Baltimore County is at 68% of the doses they've received administered. Prince George's is at 26%. Baltimore City is at 29%. We've got Howard at 85%. And some of the smaller counties have a higher year, like St. Mary's and Queen Anne's, and I believe Caroline County as well are comparable in terms of the percentage administered. This breaks down the number of vaccines administered by the respective hospitals and health systems. Some of this information clumps them together. For example, Suburban Hospital is included in the larger Hopkins system. But you get a sense of where we stand in terms of the number of doses administered and the percentage. We will get into this in further detail when we talk in the Q&A, anticipating questions that you may have. But we are working and formalizing a partnership with hospitals to be able to utilize, one, doses that they have available that have not been uptaken by their staff, as well as their expertise and potential space to increase the number of venues and satellite offices where we can utilize so that folks have multiple points of contact to get the vaccine as we move forward. Now, here's who we're currently vaccinating. Again, this information is readily available on the county COVID-19 vaccination site. Here are all of the folks who are a part of the 1A groups, Tier 1, Tier 2, and then this is the Tier 3 platform that we've brought in as well, and we're working to get vaccinated in the current setting. This is moving to the 1B group. Adults over age 75 and older are considered to be Tier 1. And then our Tier 2 strategy includes these essential employees from public transit to educators, both in public and non-public settings, child care workers, etc. And this shows you, as we continue to move through that, how the 1C group will be broken down within those respective tiers. This just shows you where we are. I'll move through this quickly. This is a little bit busy for the purposes of the webinar. This also just breaks it down in simple terms, the number of doses we've received and the total administered. And again, want to remind you of the phrase that I told you we're going to repeat is looking at the numbers. This is why this is taking time, because we've told you that we've got 50 to 60,000 folks who are in the 1A category, and you can see the number of doses that we're receiving to actually achieve and work through that. So understanding frustration to say, well, why aren't we including more sites? Why aren't we moving faster? We have maximized the supply that we've received from the state, and we continue to request increases in those doses, recognizing then the state is also at the mercy of what they're allotted at the federal level. So I will stop there, but happy to answer any questions as we continue to move forward through the presentations today. Thank you.
Thank you very much, Dr. Gales. That was very helpful. Some great information there. We're now ready to begin taking questions from our audience. If you have a question, please submit it in the Q&A function and indicate if you have a specific person you're addressing your question to. There are a lot of people here this evening, and we do appreciate you taking the time to be here. We ask that you be patient as we do our best to get to your question, and we will be compiling a list at the end of the meeting of all of the questions, and there will be somebody who does get back to you at some point in time with an answer to your question this evening. Lillian, would you provide some translation, please?
Absolutely. Bien, estamos listos para dar inicio a recibir las preguntas de nuestra audiencia. Si tiene alguna pregunta, por favor envíelo a la sección de preguntas y respuestas e indique si tiene una persona específica a la que quiere dirigir su pregunta. Esta sección de preguntas y respuestas se encuentra en la parte inferior de su pantalla y tiene las letras Q y A. Bien, hay mucha gente aquí esta noche y le agradecemos que se tome el tiempo para estar aquí. Le pedimos que tenga paciencia mientras hacemos todo lo posible para responder a las preguntas. Estaremos recopilando un informe de todas las preguntas sometidas y uno de nuestros oficiales se comunicará con usted para darle respuesta.
Thank you, Lillian. So our first question this evening comes from Julieta Acebal, and she will be asking her question to the panel on camera live during our show this evening. So if we could bring Julieta up for her question, that would be great.
Hello, can you hear me?
We can, Julieta. Go right ahead.
Great. Hi, thanks so much for doing this. I guess my question is twofold. Do you have to live in Montgomery County to receive a vaccine in Montgomery County? Or being a Maryland resident, can you go to any of the counties? And I guess the second part to that is, so I'm a school nurse in Bethesda, Maryland, and obviously you have teachers from all over, from Virginia, PG, Montgomery. Once Montgomery County does have the vaccines for, 1B, those teachers who live outside of Montgomery County, would they still be able to get vaccinated because they work in Montgomery County?
So thank you, Julieta, for your question. That is a question that we continue to discuss at the state level amongst our colleagues. The approach is that we, in our respective jurisdictions, we will prioritize those who are residents of our county. But if individuals need access to it, we're not going to turn people away. That's been the information that has been put forward by the Deputy Secretary. Now, that said, we do want to discourage folks from shopping the system, if you will. We've heard of stories where people are going online and scheduling appointments in different jurisdictions to see where they can get the first appointment. And that system creates and locks out a lot of people from being able to schedule appointments. So we're discouraging folks from doing that. And this practice is consistent with how vaccines were provided in H1N1 in terms of there not being a wrong door of entry, if you will, to get access to it. But, at the same time, we do hope that people utilize the resources in a fair, equitable way that doesn't game the system.
Okay, thank you so much.
Thank you, Dr. Gales. Our first question that came in this evening is along those same lines, and I'd like to address it if we could. It's a 76-year-old and 69-year-old Montgomery County residents who have made appointments in PG County. They're wondering if they would be turned away. So it doesn't sound like they actually would be turned away. Is that correct, Dr. Gales?
My understanding is that they wouldn't. Now, I do know that in the early stages of access to that particular link in Prince George's, there were no pre-registration requirements associated with that. And my understanding that has been changed. So what I would encourage folks who have registered through the PG mechanism is to reach out to the Prince George's Health Department to get clarification and confirmation on that. I don't want to speak out of turn and say, no, they won't, and then they get there, because we don't want to have that happen. So I would encourage them to reach out to their team to get further clarification.
Good advice. Our next question comes from Stephen Harris. He says, I understand some states are making an effort to put immunocompromised residents earlier in the rollout because of possible deaths associated with neurological conditions that put them at risk. Would Montgomery County follow the lead of other states that have done this?
Yes, I will answer that one. So we have actually prioritized individuals with immune disorders as a part of the health conditions in, I believe it's in the 1C group based upon that. So for individuals who are ages 16 to 64, who have those different types of medical conditions, they would have access to the vaccine at an earlier stage than the general population. And so certainly for individuals who have those conditions who are over 75 or are over 65, they would meet the age-based criteria regardless of their health condition based upon being in the 1B or the 1C Tier 1 and the Tier 1 for 1C status for their age.
Okay, thank you very much. Our next question comes from David Rabin. He is also going to ask his question on camera for us tonight. So if we could bring David up and allow him to ask his question of our panel.
Mr. Rabin dropped off the broadcast. He's not with us anymore.
I'm here.
There he is. Okay, great, okay. Mr. Rabin. Go
Sorry
right
about
ahead.
that. Regarding the 1B population, 75 plus, will you give priority within that group to the oldest of the old, minorities, and those that have particularly severe chronic disease when vaccine is available?
David, that is an excellent question. And if you had some spare time earlier this morning and watched the briefing with the Council's Board of Health, we had an engaging discussion related to looking at a host of factors, including many of those that you mentioned, so that there is fair and equitable access for the most vulnerable population and isn't necessarily just a free-for-all in terms of a first-come, first-serve, because we recognize that not everyone has access to a computer to do rapid online registration. And we recognize those, particularly those with more complicated medical conditions, they may be more significantly limited in terms of being able to move forward and access. So we're looking at a host of strategies. We're not ready to announce those yet, but I will say those that you've included are being looked at to make sure that it's an equitable distribution, because we do know that, for example, COVID-19 has hit everyone, but it's disproportionately impacted certain communities in terms of the number of new cases, the fatalities, both from a racial and ethnic perspective, an age perspective, a medical condition perspective, and also from a geographic consideration. So we're looking at all of those and looking at how we can come up with some creative strategies for distribution, recognizing the limitations of the system where we wouldn't necessarily be able to go to everyone's house and do one-on-one vaccination or to, particular places within the community. So please stay tuned. We did enlist all of the folks on this call, the elected officials from the county executive side, as well as the county council side, to help us come up with some strategies to do that.
Thank you.
Thank you very much. We do have a lot of folks who have their hands up, so we would like to advise you to go ahead and put your question in the Q&A function if you would, and we will try to get to your question. And if we don't, as I said earlier, we will be getting back to you personally with an answer to your question if you don't have your question read online this evening. So I have a question from Ronnie Barras. At the rates posted today, you are getting 1% of the vaccine per week for those that need it. That implies it would take 2 years to inoculate everyone. Am I wrong? I don't know if anyone's done the math on that. That's a tough question. I haven't done the percentages myself, but it does seem like it is going fairly slowly. We're hoping, Dr. Gales, that this ramps up as soon as we have a transition of power at the federal level, hopefully, and we get more vaccines produced.
Yes, I think the expectation, as was mentioned earlier, that, and this is an apolitical comment, but with the new administration that does appear to be focused more on COVID-19 response based upon the efforts that they put into place so far, including from a staffing perspective, the individuals who've been identified to serve in those important capacity roles. I have every bit of confidence that based upon their backgrounds that they will be able to expedite getting doses out the door. And so the other component is production. The new administration has suggested that they will work to get out 100 million doses of the vaccine within the first 100 days. And that includes increasing production of the vaccines we have already, helping usher through those candidates that I mentioned earlier, particularly the vaccine from Johnson & Johnson as well as AstraZeneca. Again, assuming that they're safe and everything checks out, to be able to be brought online as well within the next 30 days potentially. And those are game changers. And the other thing that is exciting about what they're proposing is that they are proposing to stand up some national federal level not clinics, but vaccine sites across the country. And that underscores increasing access, increasing network, increasing capacity, so that the expectation isn't that local health departments alone will bear the responsibility for vaccinating hundreds of thousands of folks.
Thank you very much, Dr. Gales. Our next question comes from an audience member, Justa Tosta. Lillian will introduce them and have them ask their question.
Absolutely. And whenever a member of the panel gives the answer, you won't be able to listen to the translation, but they will be able to listen it through our Spanish feed. Señora Justa Tosta, es un momento de hablar, de hacer su pregunta.
Buenas noches, mi nombre es Justa Tosta.
Señora
me
Justa,
gustaría saber...
Señora Justa, si se puede parar, no le podemos ver su cara. O se puede bajar un poco.
Es verdad.
Perfecto, muchas gracias. Ahí, ahora sí la vemos. Muchas gracias.
Mi nombre es Justa Tosta y me gustaría saber si van a incluir a las personas que padecen de asma o de enfermedades respiratorias como un grupo prioritario para recibir la vacuna, independientemente de sus edades. Gracias.
My name is Justa Tosta, and I would like to know if you are going to include people with asthma or respiratory diseases as a priority group to receive vaccines regardless of their age.
Gracias, señora Tosta. Gracias para tu preguntas. I hope I said that correctly. Thank you for your question. So in listing on our website that we've put forward in terms of health conditions, we have included individuals with respiratory illnesses as a potential risk factor for those 16 to 64 to be able to move forward through the queue before the general population.
Gracias.
Thank you very much. Our next question comes from our audience. She wants to know if an elderly person has no passport, no driver's license, and no other photo ID, what ID should they bring to a vaccination appointment? Will a Medicare card suffice?
Yes.
Medicare is fine. A Medicare card is fine. Okay, that's good to know. Good information. Emily asks, I'm familiar with the MoCo COVID webpage. However, some people have posted another URL on social media as a way of signing up for vaccinations. It is marylandvax.org. Can any of the panel members explain what that is? Do we have someone on the state level or anybody else from the council who might want to explain that? Who knows about that?
I can take a shot at it. Dr. Olstad, I'm the County's Director of Emergency Management and Homeland Security. Good evening. The MarylandVax.org's website is actually a state-run website that is used traditionally for childhood immunizations throughout the state. It has become sort of an additional site where some COVID-19 vaccination opportunities are being offered statewide. I know that's the location that many were able to utilize to sign up for some of the Prince George's County clinics. The unfortunate challenge of that website is that it does not do a very effective job of indicating exactly what priority groups are being served by the clinics that are being offered. And it does not really exclude people who are outside of those priority groups from going through the system and registering an appointment and tying it up, as Dr. Gale said, for someone else who does meet the criteria. And so I expect that many jurisdictions will utilize that site less for their clinics during the phases where we are restricted by 1A, 1B, 1C, and so on and so forth. But obviously, in the rush to meet the governor's direction to move to 1D, some sites were listed there and some sites remain listed there. So it is not a scam site, but it is not a site that I think you should expect to see many Montgomery County clinics listed on until the point when we have a more open, readily available, non-appointment-based model available.
If I can just add, do you mind?
Yes, please.
Super. So Dr. Stoddard is exactly right, but I would say that that site does serve as a clearinghouse. So while you won't necessarily see the Montgomery County-based clinics on it, you will see information on the clinics being run by the Montgomery County hospitals. And you will also see information on the mega sites that the state is going to be setting up at FedEx Field and M&T Bank. And there's the link to the list of the Giants and Walmarts and other pharmacy partners that we have on that. So it's a clearinghouse, and you can get appointments there, but it's not the central go-to place for the county. I always encourage people to pre-register for with the county as well first.
Thank you, Delegate Kelly. Very helpful. Our next question comes from an audience member who will be on video asking his question, Grant Davies. We can get you on the chat here and get you on video so you can ask your question of our panel. Do we have Mr. Davies? Grant Davies.
Grant. I don't see Grant.
Yes, I'm here.
There he is. Great.
Sure.
Go right ahead, sir, and ask your question. Thank you.
Certainly. I have two questions. The first one is, for those that get the first shot, is the county going to be guaranteeing that they will be able to get the second shot, given what you described as a very dismal performance, whether it's federal, state, or whatever level, in terms of being able to get the second shot of the vaccine?
Mr. Davis, thank you for your question. The answer is yes, that's the intention. The state has set aside second doses to provide us to accommodate those who receive the first doses. So hence this week we've, recognizing I think we vaccinated over 4,000 people. The second week they've sent us, over 4,000 doses for second doses. Now that said, and what happens is with the electronic registration system, I'll use myself as an example. I got an email yesterday that said, "Hey, Travis, you are due for your second shot. You need to go back into PrepMod and register and schedule your appointment." So there was an electronic reminder sent to my email that I used to register during the first time. So individuals will get an update and a reminder to schedule that appointment. And what we discussed in our council briefing this morning is that certainly we will prioritize those doses for individuals to get the second dose so that they can complete the full booster, which is what we highly, highly recommend for maximum protection. But if there are doses that we're finding out that the number of folks coming in for that second dose drops, we anticipate that we will not just let the vaccine sit and wait for them to come in. We will attempt to utilize those to provide as a first dose for others so that we can get as many people through the queues as possible.
Thank you. My second question relates to, I thought I heard the vice chair of the council say that you had 2,500, you were capable of delivering 2,500 doses per day. Now, my calculation is if you had 2,500 doses per day, it's going to take almost 2 years to cover the total population. And what am I missing if I'm correct about the 2,500? That's what I thought I heard.
Mr. Davies, thanks for that question. I will respond directly and then ask Dr. Gales to follow up. Right now, we have the infrastructure to be able to handle between 2,500 and 3,500 today. Now, we have the infrastructure and the scaling plan to do much more than that. But I use that as an illustration that we have currently today much more capacity than we are receiving vaccines for. But the public health team and the Health and Human Services team have been working with the hospitals, our primary care clinics, and will be ramping up a very much larger operation to scale. But we have that capacity right now. We will have even more capacity later, though.
Okay, thank you. I don't know, Dr. Gales, if you were going to add to that, but my calculation would say you'd need to be somewhere around 15,000 per day to be at a reasonable time as compared to the 2,500 to 3,500.
I would point out, and I think this is important to understand, as the vaccine increases from the federal government, the state has already indicated that it intends to open up additional opportunities through the private healthcare sector as well. And so that you will not just go to a county clinic, for example, you'll be able to go to your primary care physician, you may be able to go to a community clinic. As we're seeing with the Giant launching next week, the state will likely expand those opportunities to include other pharmacies and opportunities. The ultimate goal is that you shouldn't have to come to the local health department for your vaccine, but rather have multiple opportunities throughout the community. We know there are folks who don't necessarily trust coming to government as a site for vaccine, for example. We want them to have opportunities in community clinics and other locations. Ultimately, we like to offer when you come in to get tested, you have a vaccine opportunity. When you come in to get a food service through the county, you get a vaccine, but then also have many more opportunities that are embedded within our healthcare system that allows you to access the vaccine. But again, vaccine quantities have to increase to allow that to happen.
Thank you, Dr. Stoddard.
Thank you very much. Okay, our next question comes from audience member Jennifer O'Hayan, and she will also be on video asking her question this evening. So we'll bring Jennifer on and let her ask her question. Are you there, Jennifer? Can you hear us? Okay. Lillian, you have a question that you have from the chat that you'd like to share with us. You can go ahead with that.
Sure. It says, it's Glenda Marcela Cespedes. It says, good evening. The Latino community is concerned with the possible reaction and secondary effects of the vaccine. Also, we would like to know if this vaccine is effective for the new mutation of the virus.
I will answer the second question first and then pivot back to the first one. So by all indications so far, the science shows that the vaccine candidates that we have out now, the two vaccines, are effective in covering the variant strains that have been that are known to us to date. And so that's to answer that question. Now, on the flip side, to the first question related to side effects, I will say this: the concerns that the Latino community have are similar to what other communities are having, inclusive of also healthcare workers. We have not seen great universal uptake in the healthcare community, as there are a lot of people, and I've said this before in public settings, like my family members are waiting to see what happens. My parents they qualify to get the vaccine, and I called them before this meeting to tell them to call the health department where they live tomorrow and get their appointment scheduled. But they're able to do that now because they said, okay, we saw that you got it. We trust that you did okay with it, and we trust that everything is going to be okay. But the concerns that people have are real. Now, the side effects that have been publicized most commonly associated with either of the vaccines have been some soreness of the injection site. Some folks have reported having some fatigue secondary to the injection. Some folks have said they've had have been a little bit febrile and developed a little bit of a fever and some chills. The number of folks that we have seen with severe allergic reactions has been almost zero. I don't think we've had any severe reactions in any of the doses that we've administered. And again, this is close to 20,000 folks who've come through the queue. And I will say from my personal experience, I didn't have any of those side effects. I will confess that, I did have some fatigue, but I think that was an occupational side effect given what we've been doing for the last year. And then, had a little bit of what I would call periods of getting a little bit overheated. But they were very short-lived. I didn't have any substantial fever, didn't have to take any Tylenol to alleviate the fever, and things went fine. Now, the second dose, particularly for the Moderna vaccine, has been reported to have more of a side effect in terms of more likely to experience fatigue and some of those symptoms after getting the second dose. I will keep you posted on how that goes after I get the second dose tomorrow. But again, the overwhelming majority of everyone who's come through our program and the reports that we've received from the hospitals is that folks have tolerated the side effects well. The side effects have been minimal. And when you compare it to the potential risk of, if you get a COVID infection, developing potentially severe illness, they do shift in terms of comparison.
Thank you, Dr. Gales. We do have Jennifer O'Hayan now, so we're going to bring her on to ask her question live on camera. So Jennifer, go right ahead and tell us your question, please.
Okay, thank you for having me tonight. I would like to introduce myself. I am a senior technical advisor for my employer, Farmer On, and I am speaking on behalf of my teammates, my laboratorian teammates. We are a business located in Germantown, Maryland. We are an early phase clinical trial business. So for us, we didn't have a shelter in place period. We immediately went back to work. We developed our own COVID testing methods, both for our study participants and our employees. We also, in these early phase FDA clinical trials, we also test the different biospecimens, which range from nasal swabs to blood, to urine, and to feces. So I think I'm speaking on behalf of myself and other laboratorians in the Montgomery County area that we really worked no harder than what we did during the pandemic. And we also kept the FDA clinical trial business, kept the drug approval process going, and we also performed 2 of the COVID clinical trials, the Pfizer and the AstraZeneca. So I was very pleased to see that laboratorians were in phase 1A in tier 2 and 3. But I see now we went into phase 1B, and I just haven't had any communication about the people who work so hard to actually get these vaccines approved, and also to make sure there was testing methods for our community and our teammates. So thank you in advance for answering my question.
Thank you, Ms. O'Hayan, for your question. As we prioritize, we actually had lab workers and staff for many of the reasons that you laid out in the 1A category. And the state, included a mix of lab workers in that group, and then categorized lab workers in terms of manufacturers in the 1B group. So from our perspective, we would encourage, if there are individuals who are within those settings, particularly from an essential employee perspective, to complete the survey that has been put out so that we can get you all through the queue and get you covered.
Thank you, Dr. Gales. I do have one additional question for you. Is there any anticipation that Montgomery County will use the WAMS system, the CDC's WAMS system?
At this time, no. We are, by our, I won't say it's a mandate, but by our utilization with the state system, we are utilizing the PrepMod system for the registration to allow us to be able to track. And I just got a message from our FEPRA manager who says we are in the works process of inviting lab workers who've registered through the survey to receive the link so that you all can come in and get the vaccine.
Thank you, Dr. Gales.
Thank you, Jennifer. We have a question that came in from the audience. Following pre-registration, I expected to get a confirmation by email and/or text that pre-registration was completed. Now, this means they went to the county website and pre-registered to get notification when the vaccine will be available for them, which we will be providing that information at the end of this meeting. So to continue the question, however, no such message was received. How do I know that I am in fact pre-registered? And when can I expect to get communication allowing me to actually schedule an appointment? Thank you. Dr. Stoddard, is that something you can answer?
It's something I'll take on for this evening.
Okay, Dr. Crowell, great.
So thank you all, first of all. Thank you for the question, first of all, for this event this evening. We stood up a pre-registration site over the weekend on Friday, and one of the things that we chose to do was to get the site up and running so that people could register, could pre-register for the vaccine. The team, as of a few hours ago, informed me that they will be turning on that auto response feature for folks, that confirmation feature, so that anyone who is registered to this point will receive a confirmation. And going forward, anyone who registers will receive that confirmation. So it's a continuing work in progress, but it is up and running, and that piece will be turned on very shortly.
I think to answer the second part, though, that they asked when they're going to receive an email. Do you want to take that, Dr. Crowell?
Sure. I think that the way this is working now is that as we work through the phases and work through vaccinations, as we get close to the time for someone to come in, they will receive a message, either text message or email from us saying it's now your turn to schedule and to log on and schedule an appointment to get your first dose of your vaccine. And if you need assistance, call us and we will help you walk through that for folks who may need some help in signing up for it. So you'll get the information necessary to help you log on and register for your vaccine directly from us.
The only thing I would add is we've had 50,000 people pre-register. Yeah. We've gotten 7,300 doses this week, not counting what we have to put towards finishing up our tier 3 of 1A. So we're going to give you regular updates through that registration process, but just understand that you may not get an email to register for a clinic for a couple weeks, depending on most of it.
We're starting regular updates through that site as well. So if you are registered once, you will get a notice on a regular basis giving you an update of where we are in the process, how many folks and we've registered, how many folks have been vaccinated, and a notice when it's time for you to schedule up an appointment.
Thank you. We have a question from Susan Miller. Possibly Sonia Mora might be able to help us with this. She says, how will child care providers who have been caring for children of essential workers going to be identified and given priority? So far, we've only heard about consulting with MCPS.
I think I'm going to defer that to Dr. Gales or someone else because I'm not privy to that information right now.
Okay, thank you.
I'll take a shot, and I'm sure Dr. Gales can have one. So we did have a briefing with the child care providers last Monday evening. I encourage you to watch the recording of that because I think it'll explain what I'm about to say in a bit more detail than a single answer can give. I know the state is doing a survey through MSDE right now of child care providers. We will likely try and leverage the information that's in that survey to better inform who's interested in the vaccine and who not. So we encourage you to participate in that survey. But child care providers in Montgomery County will be prioritized in 1B Tier 2 after we finish up with our 75 and older population. And they'll be eligible to receive the vaccination. We will likely what we will likely do is match up individuals who are affiliated with the license holder. And so obviously as part of the licensing process, you're required to put your workers on that list for background check purpose and other things. We'll likely leverage that same process to identify who works with the child care providers and then make them send out through the existing connection network with Department of Health and Human Services and Maryland State Department of Education, that connection. So we're already working on that already.
Great, thank you so much. Our next question comes from Penelope Booston, who is in our audience, who will be asking her question live on camera. So we'll bring Penelope on so she can get her question answered. Are you there, Penelope? Possibly not. Okay. We do have a question in Spanish coming in from Concepcion Lozano. If we could bring Ms. Lozano on and Lillian to get her question answered, please.
Señora Concepción Lozano, este es su momento
Sí.
de hacer la pregunta.
Sí, I wanted to ask, in the case that me and my family didn't want to be vaccinated, if there will be any consequences, like can my kids can still go to school or my job be jeopardized?
Well, thank you for your question. As it currently stands, the COVID vaccine has not been mandated across the board, including schools and different employers. Now, that may change over time, but as it currently stands, there are no mandates in place that would potentially impair your child's ability to go to school or you to function within your job. But again, different employers may decide to change that, but as it currently stands, I'm not aware of any mandates that are in place that are requiring their workers to do so.
Thank you.
Thank you. Okay, we have a question from our audience. How soon can we be expected not to, how soon after you're vaccinated will you no longer have to wear a mask? So we are telling folks to keep those masks on for quite a while, aren't we?
Yes. Yes, absolutely. And the reason why we're telling folks to do that is, so even with the vaccine, there is a small chance that you could, contract COVID and transmit it to someone else. It's a low single digit percentage that could happen. But certainly in the absence of significantly higher levels of vaccine coverage, we are continuing to encourage folks to adhere to the guidelines that we put out in terms of wearing those face coverings, physical distancing, minimizing exposure to other folks outside of your home, and being very thoughtful and careful about when you interact with other folks within those spaces. Now, what's going to be interesting also is as we continue to move forward, is that there will be some additional restrictions put into place. So, for example, the incoming administration has put forward that there will be travel restrictions requiring individuals traveling into the country, including U.S. citizens, to have a documented negative test before they come back home or enter into the country. So and there's also thought that there will be a federal mandate for face coverings in federal places and venues and locations, effective potentially as early as tomorrow. So stay tuned. Say all that to say that even in the vaccine, until we can achieve much higher coverage for the general population, we will still be enforcing and expecting people to adhere to those guidelines.
Thank you. I believe we have Concepcion Lozano. Is that correct, Lillian, that she's ready to ask her question?
Yes. Señora Concepción Lozano, ¿está en línea? Puede habilitar su cámara y abrir el micrófono.
Sí, ya yo hice la pregunta.
Ok, perdón.
Ya.
Entonces sería María Celeste Mora. Señora María Celeste, puede apagar su cámara. Okay. Señora María Celeste Mora. Well, we can move to the next one, Susan.
Okay. We have Mary Kaiser asking, I am the mother of a 30-year-old man. Since March 15, 2019, he's been home from his agency that provides day services. We were informed that he can be vaccinated at his agency, which is great. We understand that disabled adults who live in agency residences will be vaccinated with their support staff. That is great. However, will you be allowing parents who act as support staff at their houses to be vaccinated with their children? That's a good question.
That is an excellent question, and I will read you the exact language that we received from the state on this question as it has popped up. So individuals with intellectual and developmental disabilities can begin receiving vaccines as a part of phase 1B. Those who reside in congregate living facilities will be prioritized as part of the federal pharmacy program. Direct support professionals will be able to receive vaccines in phase 1C. So from the state's perspective, and I understand that it's a little choppy within the situation, is that the individuals with the particular disabilities would be able to get the vaccine during the 1B phase, and those who provide support services and care for them, for example, their families and parents, would be eligible in the 1C category. So that is the language that the state has put forward, and I'm sharing with you all tonight.
Great, thank you so much. Our next question comes from audience member Tamar Gutner, who is also hopefully here to ask her question live on camera. So if we could bring Tamar on to let her ask her question, that would be great.
Oh, here I am. Okay.
Terrific.
I want to thank all of our political leaders and others, first of all, for doing their best. I hadn't realized how dire and complicated the situation was in terms of logistics and leadership. So I just want to thank you all. 19 states are including higher education, faculty and staff among the people in 1B. But I can't find anywhere on the website where university people are in Maryland. And as you know, universities are trying to open up again as soon as they can. And there are also high risk, spreader places. So I'm just curious if there's any guidance on what we'll be doing in Maryland. Thank you.
Do you want me to take that?
Sure. Great.
So I just happened to read this because this is a question we're getting a lot. We haven't had a decision made yet. The intent is to include them with the educator population, but it is under discussion this week in the Department of Health. So we're expecting further guidance soon. So a non-answer, but a very specific one.
That's great. Thank you so much. Now, again, Dr. Gales, you have been stressing this, and I don't know if any of your colleagues want to chime in on this because I'm sure they've all been busy with this question, to please clarify that pre-registration does not secure an appointment. I pre-registered my parents, 92 and 95, but was told we would be contacted when it's time to make an actual appointment to receive a vaccine. I think this is a recurring theme in the questions that I'm seeing here this evening in the Q&A function. And again, I know this was something that you really wanted to stress this evening, that we don't have a clear-cut grasp on how many vaccinations we're getting on a weekly basis, and we are in that phase 1B, but that doesn't mean you're ready to get your vaccine, right?
Right, that's correct. I just wanted to add that the pre-registration is so that we can identify folks in the county who have a number of issues that we may need to look at as we think about equitable distribution. Because we have so few doses available, we need to make sure that we are getting it to folks who have health care issues, racial inequity concerns, and or compromised health situations that put them at greater risk. So it's a way of us helping to stratify and make sure that folks get the medication, get the vaccination in a timely fashion, and to those who most need it as soon as possible.
Okay, great. Let's see, our next question, Susanna Reed. We have her in our audience, hopefully, that she could get on camera and ask her question live for us this evening. So if we do have Susanna, if we could bring her on, that would be fantastic. Maybe not. While we're waiting to get Susanna, we have, can you address why type 1 diabetes is not listed as a priority group when the CDC has it listed as such and grouped with type 2 diabetes? The criteria is that a group be at high risk which several large medical studies have shown it to be? Why did Maryland, Montgomery County take type 1 out of the priority grouping? Dr. Crowell, do you know the answer to that one?
I'm looking at the webpage right now. Type 1 diabetes is listed as one of the high priority, high risk health conditions right now. So absolutely, type 1 diabetes is a priority included in our immunocompromising condition list.
Okay. Do we have Susanna? Can anyone let me know in the booth if we have Susanna? No, we do not have Susanna. Okay, let's see. We'll go next to Jessica Baxter. And while the folks are getting her ready to come up for her question on camera, we have Lori Borman asking, can a new administration really help unless we get more vaccine providers such as AstraZeneca? And is there really more Pfizer or Moderna available, or maybe the federal government didn't buy enough and there just isn't enough? I don't know if any of our other elected officials might know more about the supply and demand, or if they wanted to try this question out. I think we've sort of answered it, but I think looking at this and seeing if we have any other providers who might be coming down the pike with new vaccines. I know Novavax is getting close as well. Is that going to change things for anybody when that happens?
Let me try. I'll relieve Dr. Gales from having to answer every question. As he mentioned today, Johnson & Johnson has a vaccine that's coming, we hope soon, and that's a one-shot vaccination. And that would be potentially a game changer. It also doesn't have the storage requirements of the present vaccinations. So it has the potential to be administered much more like the flu vaccinations that we're all very familiar with. One thing I want to pass on, if you go to the CDC's website, and I posted this in the chat, you can see how many doses are being sent to each state adjusted for the population per 100,000. And you'll see that Maryland is receiving 9,200 or so doses per 100,000 residents. And that seems to put us, it's not an outlier, it's not high, it's not low. So it doesn't seem like the state is getting necessarily less doses than other states. So I leave that with you. I think it's helpful information, at least it was to me.
I believe the incoming President Biden also has foretold that he's going to enact the Defense Production Act, which has been used in previous war times to increase production of, in wartime, typically munitions and other weapons of war. But this case will be used to create more vaccine. It'll basically have other pharmaceutical companies be enlisted to help produce more vaccine. Even the vaccine that is the Moderna Pfizer vaccine, potentially have other companies besides Moderna and Pfizer manufacture those vaccines for mass distribution. So it's going to take some time. Obviously, the president gets sworn in tomorrow at noon, and those things don't happen overnight. But we have reason to believe that over the coming weeks and months, there will be more opportunities, whether they be more pharmaceutical companies or more production of the vaccines that are already approved.
Susan, I'll just add really quickly, aligning federal policy is going to make a big difference too, because Maryland, Virginia, the District of Columbia have had tremendous collaboration, but each has slightly different approaches. And so I think with a combined federal response, it will help jurisdictions across the country be more aligned.
So there have also been some discussion about federally sponsored mass vaccination sites. So the federal government may in fact stand up some opportunities for vaccination distribution as the new administration comes in.
Along those same lines, we had a question come in, and I don't know if anybody would like to answer this. Has the county considered going directly to the vaccine manufacturers and buying additional vaccines for use in the county? An interesting thought, but not sure that that's something we can do.
They're under pretty.
So,
go ahead.
I had a conversation with one company directly, and they said that they are part of the Warp Speed project, and their entire supply was bought by the federal government. I don't know what the story is with Cuomo in New York, because he's at least said he wanted to buy. I don't know if anybody's made a deal with him, but our understanding was the companies that got that big tranche of funding were committed to all the doses going to the federal government first.
Okay, we're going to bring another audience member in live on camera, and that will be Priscilla Williams. So if we could bring her on and let her ask her question of our panelists. Ms. Williams, welcome.
Thank you all so much. Once again, just to reiterate what other people have said, this is so helpful. I feel like a lot of, I'm a teacher for an independent school, and a lot of us have been trying to get an answer to figure out when we can start the vaccine for 1B tier 2. So thank you all for all you're doing tonight. The other thing, the question that I have, because my first question has already been answered, once we receive the initial dose of the vaccine, is it possible that we can still potentially carry or transmit COVID if we're exposed to it? Can we be a carrier to either family members who might be in compromised health, and or as teachers, is it possible that we could be carriers, even if we're masked and doing socially distanced? Is it possible to spread to students or other people?
Yes, it's a very, very small, extremely small risk, but yes, and that underscores why, again, until we can get a much larger portion of our society covered, that we're going to, continue to emphasize those rules and guidelines related to coverage. And I will say, we have, as Dr. Stoddard alluded to earlier, we have met with representatives from our public school system, as well as have had conversations with representatives from the non-public schools to talk about prioritization and how to get, the number, the volume of folks who need to be covered and receive those vaccines. So even if you may not have received direct communication from your school or, a personal email, and this is for you and any other educator who's listening on the call tonight, your higher ups within your agencies are working on these questions and have been working on them for a number of weeks now. So please stay tuned for more information to come in the near future.
Yeah, we'll be holding our next non-public school webinar a week from this Friday to go over some of what we've already discussed with them with vaccine, to make sure that we're all ready to go as soon as we get into 1B tier 2.
Much appreciated. Thank you.
Okay, we have a question here from Cindy Cardaman. She says, I've been assisting in the White Oak vaccine site, and I think having mobile units using stadiums and having these clinics open 7 days a week will help. I know getting staff to administer these vaccines might be difficult. I'm a non-medical volunteer, but they need more nurses and doctors to give vaccines in greater numbers. But I'm not sure we're having trouble getting it out, that we are able to get most of them out, correct?
Yes. We've got a reserve of people that we can call up as the need increases. But right now, we've been able to get our doses out every week. And when the time comes for more, then we'll ramp up for more.
Okay, thank you, Mr. Elrich. Okay, next we have Rita Scheinberg, who will be joining us live on camera with her question for our panelists. Ms. Scheinberg,
yes,
welcome.
Hi. Yes, thank you for holding this, and I'm really learning a lot about how complicated this whole thing is, so gives you a lot of appreciation. But anyway, and I think there was already a parent that has a developmental disability with the child, but I'm a parent of a 35-year-old adult with developmental disabilities and part of the community that has self-direction supports through DDA waiver. And we are concerned about the prioritization of this population with the COVID vaccine rollouts. The state of Maryland and DDA has both promised us and said that those with DDA supports that live outside of DDA group homes will be 1B, but I don't see that in Montgomery County's page. And the concern is that even though they do not live in group homes, many of them live in congregate settings and in their own apartments, or in the home, and they have multiple staff coming in that could get infected with the virus. But right now, I mean, they look like they're in 3, if they're under 65. So I'm wondering, is Montgomery County going to move them into 1B, and how would you register? Because I don't see anything on the registration except age. You can't tell them, you can't say they have a developmental disability. At least I didn't see that. And the other question is how are the direct support people that support them supposed to be in 1C? That's what the state says. Is Montgomery County going to follow that? So.
All right, so as we previously mentioned with the state answer, we would respect the state determination on that and provide the vaccine for those with the disabilities in 1B and for those individuals providing support in 1C. What's interesting is we actually have individuals with developmental disabilities, and we have them before the state has offered. So the reason why you don't see it in 1B is we included D&D group homes in the 1A categorization because that was what we thought.
I'm not talking about group homes.
Just let me finish.
Okay.
So we actually viewed them in terms of being within that space. So it may seem that we actually have them lower. We actually do have them in a higher prioritization. And part of the strategy, again, is that all of those in group homes, in those congregate settings, have a formal relationship with a pharmacy to deliver. And so for those who aren't in those congregate settings covered by that, they would be able to utilize the county apparatus to get vaccines. Now, what the expectation is, I would imagine, is that we can go through and take a look and tweak the system to be able to have as part of the drop-down menu to make sure that individuals are covered, to represent that, to make sure that they get through the queue and they're not held up. And I think we'll have to also look at some strategies around helping those folks facilitate getting registered. Similar to, as Dr. Crowell mentioned earlier, there are efforts underway to create a dedicated line under the disease control number to help seniors who are over the age of 75 register as well.
Well, what's the misunderstanding, Dr. Gales? This is a more recent decision by MDH to make this clarification as it relates to developmentally disabled individuals. And so we'll be updating our website to reflect that change, and we'll update the prioritization and pre-registration information to do the same. Just, bear with us. It may take a day or two, but we'll get it added.
Thank you, gentlemen. Lillian has a question that has come in through our chat function. Lillian, would you like to ask that question for us, please?
Sure. It comes from Renata Pueso, and it says, "Good night, my name is Renata, and I would like to know if those without insurance will have access to the vaccine."
Yes.
And it is free, correct? There is no payment necessary for it, from what we understand.
Yes.
Okay, thanks. Here's a question from Lisa Rosenthal. She asks, are there plans to provide transportation for seniors who do not drive or take public transportation? Are there plans to reach homebound seniors? So I think, Dr. Gales, you get a break on this question. Hopefully there's somebody else out there who can answer that for us. Do we know anything about providing transportation for our seniors? Has that been discussed?
It has been discussed. We are working with a number of our partners in the community to talk about options for seniors that are going to have challenges that we know and are anticipating are going to have challenges getting to a vaccine site. We're discussing about where we might locate those sites and how we might stand them up. As we go forward, I think we will have an opportunity to create, and more vaccine is available, we will have an opportunity to create sites in a larger number of areas, and so we'll be able to respond to folks. We're discussing transportation as well as opportunities and strategies that might allow us to bring vaccines closer to people.
Just make sure you recognize that on the pre-registration site, we ask questions about the transportation need. Please do make sure you complete those, because we'll be utilizing that information to, as Dr. Crowell said, identify who's going to need those extra support. So please do make sure if you haven't pre-registered to do so for over the age of 75, make sure you do on that information include transportation needs.
And on the subject of pre-registration, I would say that it is possible for you to go and help someone in your family who is in the age range in the category to pre-register. So feel free to log on with them and fill out that information for them to make sure that they're in that system.
And we will be providing all that information at the very end of this broadcast. We have the slide with the websites, both in English and Spanish. So stand by for those. If you need that information, we will be providing that for you here quite soon. We do have Holly Clemens, who is in our audience, who will be asking her question on camera. So if we could bring Holly in and let her ask her question, that would be great.
Can you hear me?
We can, thank you.
Thank you for all you've done for this town hall and all of you working for us here at this critical time. My question is about the timing of vaccine distribution for kidney dialysis centers in Montgomery County for the nurses and for the staff. In our clinic, we have 3 sessions per day of patients, and the clinics in the county and state, they have the staff ready to give the injections. And what about caregivers at home like myself? I'm not 75 years old. I'm 73, taking care of my husband that's 75.
So we actually included the dialysis centers in our healthcare workers. So if there are any folks at the centers who need coverage or need to get the vaccine, please, fill out the survey as soon as possible to make sure that the staff does get access to that.
The staff has told us that they haven't had. So what do I tell them?
So there's a survey on the county site that they can complete and fill out. And that way we'll have their information so that the COVID-19 vaccination team can send them the necessary links so that they can get registered to get covered.
Okay, so the vaccine isn't being delivered to the dialysis center. They need to go elsewhere.
Yes.
I think that might have been the problem. And for the patients, you don't know yet, right? The 3 sessions of patients and home caregivers?
So the home caregivers are, again, coming through in terms of how they're prioritized within a later session as part of the 1A grouping. And as far as the patients are grouped, based upon the age, and then certainly individuals who are under 65, but who are in that medical category with that condition would receive coverage within the 1C grouping.
Is there a place on the pre-registration where we can write kidney dialysis patient?
I'm going to.
I believe there is.
Yeah, we're gonna.
Yes.
Go ahead, Dr. Crowell. Sorry.
I believe there is one where you can put that in there as a other condition.
And we will be expanding the pre-registration sites beyond 75 and older to include the other tiers within both 1B and 1C over the coming certainly days and weeks. I would say probably close to weeks, but we're working hard on this issue. And so in the pre-registration there, we will have an opportunity to include the information around underlying health conditions, because that will be one of the categories within the 1C phase. So we're working on it right now. We obviously wanted to get the 75 and older one launched as quickly as possible because that was the first grouping within 1B that we had to address. But we're looking to add on the other groupings within 1B and 1C very soon.
And if I could just, Dr. Stoddard or Dr. Gales, we've referred to it. I just want to be clear for folks. Pre-registration also means survey. That's a synonym.
Oh, no.
That was unclear. If you were listening, you might be unclear on that. Could you all just clear that up?
So when we first launched this, we put it out as a survey to healthcare professionals, and that was how it was listed until this past week when we shifted it to talk about pre-registration.
Right, but now they're one and the same.
Now they're one and the same.
Okay, so Holly, you got that. So if you were in a previous group, you under Dr. Gale's guidance, a healthcare worker, you were in 1A, you could have signed up via survey. Now now everything's through pre-registration. So hopefully that makes sense.
I'll talk to them. Right now, it just asks name, address, age, and gender. So he's 75, so I couldn't add any health. But you're saying that will change.
Yes.
Yes.
Okay. Thank you. Thank you very much.
Thank you very much. Okay, we have a question from our audience member. I believe you mentioned that you have capacity to vaccinate 2,500 people a day. Is that right? Is it more? It's more than that, isn't it? More than 2,500 a day?
Right now it's between 2,500 and 3,500.
Okay, and so the rest of the question goes, does this just include what the county health department can handle, or does this include allowing private medical practices and other avenues to vaccinate as well?
So this is inclusive of the doses that are delivered by the health department. It's important to distinguish how this lays out. So currently as it stands, the doses of vaccine, the vaccine doses that are provided by the state are shipped to hospitals and health systems, to long-term care facilities, to pharmacy partnership, and to local health departments. At this stage, they are not being shipped to private providers. So private providers can register in the state system, the Immunet system, to receive vaccine doses when we get to the point where the state releases those doses to private providers. But as it currently stands, they are not able to receive vaccine. Now, part of the challenge with that, someone would say, well, it will increase the capacity. Yes, but again, remember that message when I said you would hear multiple times? Well, here it is again. This is all operating out of a fixed supply. So if we bring on private providers as it currently stands with a fixed supply of 72,000 doses, the doses that they would receive would be doses that we would not receive in the health department. And the expectation, as Dr. Stoddard alluded to earlier, is that as the volume increases and the number of doses increase, we'll be able to provide more doses not only to the health departments and hospitals, but be able to provide an overwhelming significant number of doses to the private provider network so that folks will have multiple places where they can access and get the vaccine. And we'll be able to move the county apparatus to be able to provide coverage for individuals who don't have access to the private healthcare enterprise, may not have insurance, or may be locked out of that system in some way, shape, or form.
And if I may add, just for clarity, and I agree with everything Dr. Gale said, except I want to add that since it came up at the top of this meeting, in addition to giving doses to the hospitals and the long-term care partnership with the pharmacies, starting January 25th, Giant, 4 locations, is going to be distributing vaccines in Montgomery County. The governor's plan intends to expand that to Rite Aids also. They're in negotiation right now with Rite Aid and Safeway. The intention is to grow that from a pilot with 4 locations in the county to many, many more. And I think as the county executive mentioned earlier, they're getting about 50 doses a day per pharmacy. We're expecting they can do maybe 30 to 40 shots a day at each of those 4 locations. So it's not a significant number more. And those doses are coming from what used to be the county health department's allotment.
Terrific. Thank you so much. There are a lot of questions that are coming in about this pre-registration and what happens once folks do pre-register. Will they, once we are in that phase 1B and those vaccinations become available for that population, can anyone provide any instruction of what's going to happen? What can these folks expect? Are they going to get a call? Are they going to get an email? Are they going to get a text? Have we laid out that plan for them?
So the way this is currently structured, they will either get an email or a text or a call, depending on what they entered in when they registered information. When they registered, indicated was their preference when they registered, pre-registered. They will get some instruction and receive a link that will allow them to go to the PrepMod system and register for an appointment in the county. And once they've completed the registration, they will then be given an opportunity to schedule their appointment at a site. For vaccination. We're one of the things Dr. Stoddard, I think, mentioned earlier is that we are in the process of standing up a support line for older adults or folks who may not have good digital access and who may have experienced challenges in working on this kind of technology that we're living in now, so that we'll be able to help walk them through the registration process when it is time.
Terrific. Another question for 1A healthcare workers who have received the first dose from the county. When will we get emails so we will be able to schedule the second dose? My second Moderna is due next week. I know there are many of us in this situation. Thank you.
It should be an automated message coming. As I mentioned, I'm scheduled for mine tomorrow. I received a link, I believe Sunday evening or Monday morning, to complete. And part of that also is influenced by, ensuring that we get the supply from the state to be able to stand up and schedule. And to the point, to give some background in terms of how the clinics are stood up and scheduled. So folks say, well, why aren't we scheduling out clinics for weeks to come? Well, I'll tell you why. So the state receives their information from the federal government somewhere along the lines of Tuesday or Wednesday of each week in terms of how many doses the state will receive for the following week. The state then in turns goes through and with that supply figures out how they're going to allot it to all of those different places that it has agreements and arrangements to ship doses to. Unfortunately, that process takes time, and we have not been notified until late Saturday afternoon or evening, or unfortunately this week we didn't find out how many doses we were going to get until Monday afternoon. And so once we find that out and get the doses confirmed, the local team pivots very quickly to stand up clinics based upon the number of doses that are available. And so as a result, that creates the challenge of where there may be some delays in notification. And let me just check, I'm getting a text from, I was told next Wednesday's clinic should be sent to people tomorrow. What they're trying to do is, again, once we get notified from the state in terms of the doses, we're working to give people a 1 week advance notice. So for individuals such as the person who asked that question, you should be hopefully getting a link to schedule your appointment on tomorrow.
There you go. Great. So our next question comes in from Arlene Lux, and she wants to ask this of Sydney Katz. So Councilmember Sydney Katz is still on the line. This is for you. Okay. What will you be doing for Leisure World? There are 8,500 seniors in need of vaccinations. Are there any plans for a vaccination site at Leisure World? Do you know anything about that, Sydney?
I do, and in fact, Dr. Gales and Dr. Stoddard know about that, as does Dr. Crowell. All three of them know, because I raise that continually, not just for Leisure World, but for Asbury and for Villages of Rockville and other areas as well. Dr. Stoddard, is there any update? I know you were touched on it before, but is there any update on it, please?
Yeah, we're working on a plan. It's likely going to involve our fire and rescue department doing a clinic. Obviously, we are looking to hopefully finish up tier 1 or phase 1A, tier 3 this week, and be rolling into our 75 and older population. And obviously, given the size of the community at Leisure World, that is certainly one of the locations we will be looking to schedule over the coming weeks, particularly with our fire and rescue departments. I don't have a specific day yet, but I do know that we are working to have a clinic out there. And I will also say that, for the Riderwood and Asbury communities as well, you're being thought of as well. So understand, we know where our large senior populations are at, and we will, to the extent possible, be trying to make clinics available at each of the large ones. Obviously right now, and I think Dr. Gales alluded to this before, it's hard to get into smaller communities, but certainly we know where our largest senior communities are, and we will look to do clinics in them in the earlier phases of our rollout into 1B tier 1, and certainly 1C tier 1 as well, with 65 and older.
Thank you, and thank you for asking the question.
Gilbert Eisner asks, if some counties are not using all their allotment, can that be utilized by our county either immediately or in future allotments? As far as I know, most counties do have a waiting list, don't they, for folks who are on a list. If somebody doesn't show up for a vaccine, they'll get a call. Is that correct? Do we have that here in the county?
Yes, we do. And to the point, there have been discussions about, so the way, it gets a little complicated because we have talked about this at the state level in terms of how to move people through the queue. Now, what the state is doing is, as part of their, in my previous comments, what I alluded to, when they're trying to factor how many doses are sent to each jurisdiction, they do take a look at to see how many doses you're putting out. And so if you're just sitting on a bunch of doses, that could influence the number of doses you get the following week. And so that's why we have pushed to, in fact, to give the updated number, we have distributed 99.6% of the doses we've received. And in being able to go each week, we send a note to the state requesting an additional supply. And having conversation with them, they say that, being able to get it out successfully benefits us in terms of how they look at the next week's supply. Now, I do know that there have been some discussions about how to, potentially move doses around. The challenge is that, for example, in smaller jurisdictions, for example, some of the smaller counties, their initial allotment was 500 doses. That was enough to get everyone in their county who was 1A through the process. There were a number of counties that fit that. And so as they continue to use their doses, they're moving through to 1B and going to move through 1C. So it does make it a little bit challenging to just say, you only are using X amount, we're going to take that and send it to a different jurisdiction. But I say all that to say that the state does factor in your success and ability to get doses out the door and thinking through your next set of doses that they're providing.
Go ahead, Dr. Stoddard.
I was also going to say we're also working closely with the hospitals to do the same thing. And you'll see tonight, actually, while we've been on this town hall, Adventist has posted some, they're going to have some availability of their vaccine at their White Oak and at both locations, and also Fort Washington down in Southern Maryland. So the hospitals, I mean, we've been pushing hard that the hospitals activate theirs because obviously we control that more. I know that there's some, there's other places that there's some different situations across the state, which I'm sure Delegate Kelly can speak to about how other counties are trying to get their vaccine out. But I think we've pretty much said we're going to put our head down, do the work, get the vaccine out as much as possible, and make it hard for the state not to give us more doses because we're being successful in getting stuff out. So.
And I think I'd just add, because Dr. Stoddard made the point that I was going to make, that when we look at how much the state has allocated in the first several weeks of this program, it was actually the hospitals that were not able to vaccinate as many people. They were the lower performers. And as a result, they ended up with more than 200,000 extra vaccine doses. So what has been happening over the last week is a concerted effort to make sure that those hospitals are community partners and starting to vaccinate the community. So that's where we're seeing this Adventist partnership. It's where the doses to vaccinate Riderwood and I think Leisure World are both coming from. So we're trying to, instead of robbing Peter to pay Paul in terms of the different counties, trying to make sure to free up those doses that the hospitals were unable to use.
Great, thank you very much. We have time for one more question very quickly. Lillian Moss has Adela Vega on the line, I believe. She will be asking her question to the audience in Spanish. Lillian?
Señora Adela Vega, es momento de hacer su pregunta. Debe de habilitar su cámara y abrir el micrófono.
Well, I've just been told by the staff she is not there, sadly, so we did not get to have her ask her questions. We apologize for that. We are about out of time. We want to thank everyone who participated in this important discussion this evening. As mentioned earlier, the county has a website where you can get the latest information on the COVID-19 vaccine and other services available to residents during the pandemic. On that page, you can sign up for text and email alerts when new information becomes available. And if you are 75 and older, you can pre-register for your vaccine and you will be notified when it's time to make your appointment. In the meantime, stay safe and continue to follow best practices in order to stay healthy. Lillian, I'll turn it to you.
Gracias a todas las personas que participaron en esta importante discusión. Como se mencionó anteriormente, en el condado tiene un sitio web en donde se puede obtener la información más reciente sobre la vacuna contra COVID-19. Y también puede encontrar toda la información pertinente a lo que se refiere a la vacuna y en materia de salud. Usted puede encontrar, además de esta información, maneras como usted puede mandar mensajes de texto para recibir información. Y si tiene 75 años y más, puede agregar su nombre a la base de datos y se le informará cuando sea el momento de hacer su cita. Mientras tanto, manténgase seguro y continúe siguiendo las mejores prácticas de prevención para mantenerse saludable.
Thank you, Lillian. And I also wanted to mention that we did have a lot of folks asking about Dr. Gales' slides earlier this evening that they could not see. We will be posting those on the council's webpage tomorrow, so you can take a closer look and take your time at looking at that data to get more information for yourself. So with that, I'm going to turn it back to Council President Tom Hucker to wrap up the evening.
Thank you so much, Susan. I want to thank all my colleagues and the state lawmakers who joined us, including Delegate Bonnie Cullison, who joined us after the introductions, and the congressional staff as well. Thanks so much, County Executive Elrich and Dr. Crowell, Dr. Gales, Dr. Stoddard for all your updates. Thanks so much, Susan Kennedy and Lillian Mass for your great support tonight, and all our public health representatives and HHS staff and council staff for pulling this together on very short notice. We had incredible participation from thousands of you across the county and hundreds of you submitting questions. So we'll do our best to get all those answered. I want to just emphasize that the county government and all of us on the council are all here for you, so please don't hesitate to reach out with ongoing questions or service requests. There may be a sense that this emergency is close to being over, but I know Dr. Gales and all of our health officers would want to remind you to continue to adhere to our public health guidelines. I'm very proud to say that our community continues to be very resilient and caring throughout this emergency. We're all very proud to represent you on the county council, and we're fully committed to working together with our partners in the state to ensure that we streamline the vaccination process and get our residents vaccinated as quickly as possible. Thanks again to everyone for joining us tonight.
Thank you very much. Good night, everybody.
Good night.